Doctor, could you share what type of bone graft was used? It's xenograft, right? And also, what guided your choice?
In general, there are four main types of bone graft that we can offer to our patient. Firstly would be autogenous bone, which is harvesting the patient's own bone. For instance, from the chin or from the ramus. Autogenous bone graft, which is patient's own bone, the gold standard for bone grafting in general. Okay, but if we are going to harvest a piece of bone for patient, it means that we are actually exposing the second surgical site other than our implant site. Okay, so we only use it if we need a bone block or we need quite a significant amount of bone, then only we get the bone from patient own bone. Second bone is allograft. Allograft is from human species. Okay, so we get it from processed cadaver bone. Okay, so that is a second source of bone, which is allograft. Alright, the third one is xenograft. Okay, xenograft, it could be come from different animals, but because we are from Malaysia, we have Muslim patients, they might want to avoid the origin, which is from bovine pork. So we have to be careful with that. Lastly would be synthetic bone, which is known as alloplastic bone. So these are the four main types of bone that we can offer to patient as a clinician. Alright, so now we have to look into the features of the bone. In what kind of scenario we have to use this kind of bone, and what kind of scenario that we have to use the different type. Okay, so for anterior region, we actually need some bone that have lower risk of resorption. Okay, we want the bone to retain there as long as possible. Okay, so xenograft fulfill these features whereby it can have a very low rate of resorption. That's why I actually use the xenograft, which is bio-os in this case. And for cases like when this is not very critical, like posterior region, my preferred choice would be allograft, for instance, like sure-os.
Okay, Doctor, I came across a review article talking about mixing different graft material in order to achieve long-term bone stability. Is it possible to do so?
Yes, that's right. Okay, so for instance, right, I mentioned about the first type of bone would be allograft. Sometimes when we harvest the patient's own bone, either from block or by using bone scratcher, we harvest some particular bone. Then we actually mix with some bone so that the bone amount that we receive is more. So firstly, we could actually harvest patient's own bone, which is the autogenous bone and also allograft. Or if we are doing sandwich technique, okay, then the first layer near to the patient bone, we can put a little bit of patient own bone or sure-os, and then we cover with xenograft because the xenograft have a lower rate of resorption. Allograft actually has better bone condition.